My name is Jessica. I'm 32 years old, and I'm from Omaha, Nebraska. I lost my left breast, and I am desperate to find it. I was a pretty normal kid. Everything was great until the weight gain started to happen. Anytime I was stressed out or had a problem, I turned to food for comfort. By the time I was 15, barely 5 foot, over 200 pounds, kids are mean. I was picked on and just miserable. So at 25 years old, I got pregnant. I was probably around 230 when I delivered my son. I looked in the mirror one day and said, I have to do something about this to be a happy, healthy, productive person, to be a great mother for this baby. And so I started every workout video you could imagine, and I was done treating my body like crap. It was the best thing I had ever done for myself. So as we all know, when you lose a lot of weight, you are left with extra skin. I decided to go get breast implants to fill in the skin, and that turned out to be a nightmare. The very next day, I knew something was terribly wrong. My left breast was swollen up about double the size of the right, and my nipple was turning purple. So I immediately called the doctor. Her final decision was, let's see if it absorbs on its own. Seeing your nipple turn black and scab is the scariest you will ever see. It's like watching your body die in front of your eyes. So I decided to make an appointment with my primary doctor, whom I'd been with for 10 years. My doctor was appalled and said, you have MRSA. It's been eating your tissue. I was terrified. The death rate is 40% once it gets in. I had 2 surgeries to remove the infection. And when I came out, I had nothing left. The implants were both removed, and the scars were just unbelievable. It looked like a shark had eaten me. As a result of the surgeries, I suffered severe nerve damage on the left side of my arm into my hand. I couldn't use my arm for months. It's painful in everything that I do. I had to work and work and work to tie my son's shoe. I had doctor's notes signed for permanent disability. I was buying nerve pain medications and painkillers out of my pocket. At the end of all of these surgeries, I couldn't tell you how much I spent. I couldn't afford my home anymore. It had completely broken me. I moved in with my mother so that she could take care of me and my son. I knew the gym was going to be the first thing to save me. It was going to rebuild my physical strength, and it was just something to get back to normalcy for me because it had been such a big part of my life. Spot.
I think it's complete bull what happened to Jessica. She's lost everything. She lost her home, she lost a job, she lost a boob. I mean, it's a lot to lose.
I feel like I look like a man because of the proportions. I tend to just not try at all. Baggy clothes and no makeup are pretty common for me these days. I am dying to feel like a woman again. If I can just look symmetrical with my clothes on, life would be a billion times better.
It's funny, my office, they can tell how hard a case is by how many times I sigh. This is a multiple sigh case. This is actually a really, really sad story. This is a girl who had a breast augmentation, just a routine breast augmentation. She suffered blood supply problem to the entire breast.
How does that happen?
I don't know. Look.
God, she almost looks like she's a cancer reconstruction patient.
She lost the entire left breast. So let's bring Jessica in and ask her what's going on.
Can you please send in Jessica?
Hello.
Hi, Jessica, Dr. Nassif.
Hi, nice to meet you.
Hi, Jessica. Terry Dubrow, pleasure to meet you.
Nice to meet you. It's gonna take a miracle to make me look normal, but they are the best doctors, and if anybody can do it, I totally trust them to do it.
So this all started with a simple breast augmentation, right?
Yeah, I decided to treat myself to breasts for my birthday. This was actually last summer.
Okay.
The very next day, the left breast was swollen up twice the size of the right breast, and the nipple was turning purple.
Okay. Hematoma.
So I went back to her, and she said, why don't you come back Friday? I've got surgery all day, but if you get to the hospital early enough, I'll take a look to see what's going on.
That's a surgical emergency that is now pressing on the underside of your nipple, cutting off the blood supply and potentially the surrounding breast tissue. There are a few absolutes in medicine surgery, and one of the most significant is that when you get a collection of blood in a pocket in the body, you go right to the operating room and you remove it. And the nipple is turning darker this whole time.
The nipple was black at this point and crusting over. And the incisions themselves are bursting open at this point and oozing and bleeding. And she looked and she said, that's gonna absorb itself. You're gonna be fine. I knew it was infected. I could smell the infection and I just trusted her. So I go to see my family doctor, and the second I took my shirt off,
she freaked out.
She freaked.
Of course she did.
You have MRSA.
Oh, God.
Oh, God, yeah, MRSA.
You didn't go to a surgeon. You went to an assassin.
If the MRSA became that severe that it eats through the muscles and then the tissue overlying the rib cage, it could have got down to the heart. Obviously, that would not have been good.
We did the surgery. I had them remove both of the implants. They cut off most of my breast. I was sewn up vertically.
Right.
I had nothing left.
You basically had a mastectomy, not to a cancer, but due to a cancerous doctor.
You know, being the stick that I am, I always was like so envious, especially in the gym, of her freaking perfect hourglass shape. And then it was like, they stripped her of her lady parts.
You got screwed.
Yeah.
Having a weird, ripply stomach is always on my mind. Because people talk in my comments and they make fun of me for it. I don't need your little bitch ass telling me to go fix that.
It's just an ugly nose. And as much as my friends and family try to assure me that I'm still beautiful, I know what I see.
Okay, so Jessica, it's all about tissue quality, tissue thickness. So let's look at this one. This one has well-healed lift scars. You actually have a good amount of breast tissue. You lack upper fullness. We can make this one look very good very easily. It's all about what can we do with this one, because essentially, because of your soft tissue infections, you've lost the lower insertions of your pec major. So you have no pectoralis muscle in the lower half where we normally would have that. That's what's giving her that concave depression in the lower part of her chest and makes the reconstruction very difficult. What we have to do is find a way to get you a breast mound that won't get infected, won't kill the overlying tissue the way it happened before. Not easy. However, this is not our first rodeo. This is what we do. I think we can actually give you a good-looking left breast, and then we will make you an areola and a nipple that looks as good as the other side, just as long as we don't run into a complication. But I can promise you, if we run into a complication, and we may because you're at high risk, I will be all over that complication. I will not leave you hanging. We're gonna try and make this positive for you. All right.
Thank you.
Pleasure meeting you.
Nice meeting you.
Nice meeting you.
Nice meeting you.
Thank you so
Thank
much.
you guys so much.
Dr. Nassif and Dr. Dubrow are little angels sent from heaven. Thanks for coming. Thank you. You hug me topless. It's not, there's no boobs. There's no boobs, it's not weird. There's no boobs. I'm getting nervous. Today's the big day. I'm going to get my breasts back and look like a woman again.
Jessica,
Hello.
how are you?
Good, how are you?
Good.
Are you ready?
Are you ready?
I'm ready.
Okay, good, because we have things to talk about. So you have a couple unique situations that we don't normally deal with. You lost the left breast and the left nipple, and you had that really bad flesh-eating disease. And you have that muscle issue where you have part of the muscle. Mathematics are what this case is all about, because there is a major size difference between the two breasts. The left breast essentially has no tissue, so I have to find a way to get both symmetry, three-dimensionality, and a shape. For Jessica's surgery today, I'm going to start by making an incision in her right areola and then elevate the pocket. Next, I will remove any unwanted scar tissue and put in a new implant. Then I'll explore the left side to determine how much muscle and breast tissue I have to work with. I'll create a new breast pocket and insert a high-profile implant while hoping to achieve breast symmetry.
I wish I could say everything is going great, but unfortunately, I've had another MRSA infection. I think it was probably about a month after the surgery that I noticed some really weird spots in different parts of my body. So I ended up in the emergency room where I was told that the MRSA was back. I never imagined that I would be facing this again. I had hoped this last surgery was the last, but it seems we're going to need another one. The left breast has been sliding underneath my armpit. It's just not in a stable position. This one, there it goes. I know that the MRSA severely damaged my pec muscles to begin with, and that's to blame for my current issue. I'm just hoping Dr. Dubrow can find me a permanent solution.
Hi. How are you? Good to see you.
Thank you.
Okay, so we had a little complication, right? Obviously, all those infections and everything ate up the muscle. The muscle that I tried to put together was obviously too weak to hold the implant in. And so now we have to fix the complication. Jessica's infection clearly undid my original surgery, and I'm concerned that any further surgery could be undone by a recurrent MRSA infection. But knowing that she was treated in the emergency room with the appropriate antibiotics probably means that we won't be seeing this infection again. At the very least, my fingers are crossed. Hello. So let's chat and see where you're at. Let me see. Are they soft?
Yeah.
Did the repair hold?
Yeah, it's holding so well.
Good.
Like, it feels incredibly stable. I even started like chest pressing last week.
It's good to see that Jessica's surgery site is remaining very stable. There's no evidence of any MRSA reinfection, and she's doing really well. From my point of view, you have good symmetry, you have stable implants, foreign bodies in place, you have no signs of an infection. You need a nipple. That's all you need is a nipple.
I have been waiting for this day for a very, very long time. It has been about 2 years since I've seen myself with 2 nipples.
Jason is the man. He's the magic nipple man.
Take care of you.
Yeah. So let me show you what's going on.
Absolutely.
Okay? We reconstructed this one. Isn't that a great breast?
Great job.
Yeah, and then just as a little bonus, he's gonna put a little tattoo there of my face, right there. Of me going like this.
Having Dr. Dubrow as my doctor has been the biggest blessing. I knew that there were risks and complications going into these surgeries, but I was fully confident if something should happen, I'd be in the best hands. And through to the end, he has been amazing. Oh, wow. Before my surgery, my left breast looked like it was eaten by the MRSA shark. I was extremely lopsided, and as hard as I tried, I could not build myself a breast at the gym. But now, thanks to Dr. Dubrow, I can finally say that I'm MRSA-free. I have symmetric breasts with matching areolas. I am very grateful for where I'm at, and they aren't perfect, but I feel feminine again, and I'm going to wear my scars proudly.
You've come a long way. I hope it stays like this for a long time. Congratulations, you got pretty breasts, and pretty is good because you're a pretty girl, okay?
I'm feeling very strong, both mentally and physically now.
And congratulations. You look great.